All right, good evening, everyone. I'd like to call the September 11th Program and Budget Committee meeting to order. And with that, I will read our mission statement. Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence. And as you all know, today is September 11th, and I'd like to pause for a brief moment of silence to remember all of those that were lost 18 years ago. Thank you. All right, next item is the adoption of the agenda. I'll take a motion to approve. Motion from Chris, support from Nick. All in favor signify by saying aye. Aye. All opposed? The agenda is adopted. Next item is hearing of the public. Anybody from the public wishing to speak, you have 5 minutes. Please give us your name and address. We do not respond back at this meeting, but if you leave your contact information on the sign-in sheet over on the ledge over there, someone will get back to you. Please be advised that these meetings are video recorded, and the general public will be able to access the recordings on the internet by going to comi.civicclerk.com. Anybody from the public wishing to speak? Going once? Going twice? All right, we will close the first hearing of the public. Next up, request to approve item 5A, request to approve a request for proposal for adult licensed residential services. I'll take a motion to approve, and then we'll have Christina come up. Support. Motion from Kathy, support from Selena.
Good evening. So we want to do the RFP for the adult licensed residential services because we have found a need in the system for homes that would have more programming or more services offered rather than someone who's going to go to a day program and leave the home every day. We want to write the RFP in a way that solicits providers that understand that they're going to be taking higher needs individuals, that their ratios in the home are going to be higher. Perhaps they're going to bring in additional staff, such as a nurse or some sort of a therapist or something to happen in that home to create a more stable environment for that individual. So it's going to be a little bit different than just a standard licensed home. So we're finding that we have a lot of people perhaps getting stuck in a hospital or home with mom and dad for longer than they really can be. Mom and dad can't manage any longer and they need the individual to move out. But a standard home that might be staffed in a pattern which would have 2 staff on the morning and 2 staff in the evening and 1 staff overnight is not enough to support the individuals. So that's really what we're looking to pull out of this. We're hoping to release it in October and have about a 4-week turnaround for the proposals so that we can get something back to you before the end of the year.
Thank you. Any questions? All right, seeing none, we have a motion and support. All in favor, Nick, do you want to? No. Tony, do you have a question? No. Okay. Everybody's raising their hands. I don't know. All in favor signify by saying aye. Aye. All opposed. Motion passes. Next up is item 5B, request to approve a request for proposal for community living supports. I'll take a motion to approve. Motion from Chris, support from Nick. Christina, go ahead.
So this is similar in the way that the folks that we need this service for might want to stay home or have an ability to stay home either with natural family members or roommates. But we want to, again, target providers who understand that they're going to take individuals who have higher needs than maybe the CLS cases that they're used to, the community living supports cases that they're used to. So we want to write this one in a way that will pull that out of the maybe current providers or new providers within the area. We've also had a difficult time getting the providers, they don't have enough staff. And so we're seeing, well, I'll take the case, but I don't have anyone right now. And so we need more direct care workers in our system. So this can help both of those ends where we can provide a stronger network of CLS providers, but also help with the staffing issue that we're going through.
Any questions on this item, Nick?
Just real quick, how does that help you? I understand the need for more providers, but how does this RFP help you with having the providers hire direct care staff?
If we
Or
can get
help
some, the current providers won't necessarily be able to hire new direct care staff, but we'll see if there's other providers within our community that aren't contracted with us that have staffing
Oh,
that they
okay.
can provide for us, so.
Gotcha.
So we'll write it in a way to pull out those that understand you're going to be serving possibly a different population than you've been used to serving, but also if there's new providers in the area. You know, honestly, my division gets calls every week, probably 5 to 10 calls of people that want to contract with us. And because we do hold tight to our RFP process, which I think is really important, we need these proposals to come out so that we can look at those providers that are interested in onboarding with us.
Gotcha.
Tony?
Do I understand this is not going to go to current providers that you already have a contract with?
If they already have a contract, they can increase their business with us. They won't need to submit a bid.
Okay, have they been told they have that option?
Yes.
Thank you.
Mm-hmm.
Any other questions or comments? All right, seeing none, we have a motion and support. All in favor signify by saying aye. Aye. All opposed? Motion passes. Thanks, Christina. Next is item 5C, request to approve out-of-state travel for veteran navigator to attend conference at the University of Utah College of Health. I'll take a motion to approve. Motion from Ryan. Support from Lori. Any questions or comments on going to Utah? No? All right. All in favor signify by saying aye.
Aye.
Aye. All opposed? Motion passes. Oh, no, we're done. Linda, go ahead.
Sometime, we voted on this a long time ago when we were meeting at the health department to have a navigator can we have a report sometime on what they do and how it's working out in the county? Thanks.
All right, next is receive and file. We have no items to receive and file. Item 7, resolutions, no resolutions. Item 8, other agenda items. Any board member have any other agenda items before I turn it over to Dave? All right, Dave, take it away.
Good evening. I just wanted to update everybody. We were on the 9th, we were on a call with the state of Michigan and Milliman. They did release the new Medicaid capitation rates for 2020. We have until tomorrow at noon to supply any additional questions. We did go through their report in detail. They're looking at putting an additional $244 million into the CMH system statewide. Some of that will be specific to the autism spectrum disorder for the increase in the prevalence or the number of people seeking services in that area. They're adding a 0.75% to the administrative expense cost, again, statewide, which should give us a composite administrative rate of 6.75%. They're targeting that increase at the being able to put money into the reserves. So that was good news as well. They've changed some of the risk factors that go into the funding model. They're not looking at the locus score anymore for this current year. The locus is the assessment of for adults with mental illness. There was not enough information in the system statewide. There was too much of a discrepancy between each of the PIHPs, so they removed that factor. They did add a travel factor into it, which listed Macomb County as 100% urban. The more rural you are, you get an additional time factor into the weighting of the Medicaid rates. But overall, for Macomb County, unless there's changes, the relative to April 1st of 2019, our rates are projected to go up 9.6%. The effective rate of the increase without autism is 5.9. The effective rate of the increase with autism is a 7.8% increase. So beats a sharp stick in the eye, but revenue's projected to go up. The other factor is they're eliminating, the children's waiver program is currently a fee-for-service. So any costs that we incur through the provision of service, we submit the bill to the state and we're reimbursed. That's going away on October 1st, and they're putting the children's waiver reimbursement into our Medicaid capitation rates. We have a lot of children's waiver cases, and I was fearful that that might not work out in our favor. We did some quick projections, and we came out about $200,000 ahead if everything remained the same as this fiscal year. So it's looking, I'm cautiously optimistic, and we'll keep you posted.
Nick, and then Kathy.
The Medicaid rates were, the last time they did this, were subject of great debate, to put it mildly, and great concern to all of us. One, can you send that around to us? You send a lot of things around. I really appreciate your use of the email system. But secondly, one of the most concerning pieces in the previous rate adjustment and what essentially put us so far behind was failure to include historical data as a factor, historical costs as a factor. Has there been any change in that? And if not, why aren't we raising that issue?
What they are doing is they're doing a blend of the new factors against historic spending on 6 months back. So every 12 months, they'll be looking 6 months back and then doing this blended increase going forward. The email that I have on this is there's 4 or 5 attachments, and it's extensive. The one document, I believe, is like 283 pages. So I will send it out. I wouldn't hit print if I were you. There's a lot of information in there. After the 12th, once these become final, I will do my best to provide an executive summary to this body.
Just as a follow-up, the 6 months back blended issue may be something to be concerned about, because essentially prior to the last Medicaid rate actuarial determination, the factor that was taken into consideration was penetration, the number of people in the community, because of the fact that we were in a catchment area for closed hospitals. And while that was being phased out, it dropped off the cliff three years ago, and that really hurt us. If we're only looking back 6 months to our actual, that should help us some, but it may not be sufficient, because basically what they're doing is looking back over after the cuts rather than looking back to what the actual need was. But I'm interested in seeing that, and I know we don't have much say about this. We've already signed the contract, and they just plopped these rates in, which is a concern all of us have had for a long time. But I appreciate your keeping on top of it. Thank you.
Thank you.
Kathy?
Thank you for the report. I have a question about the waiver that used to be billable, you said is now part of the capitation rate. Is that part of the 5 or 6% increase? Oh, so how much of that, if we separated that out, what would the increase percent be?
I will get those numbers.
Significant?
I want to say we're about $3 million, between probably $3.5 and $4 million for children's waiver.
Okay, so it's not a huge percent then. I mean,
Right.
but it's part of it.
Yeah, they did roll that in. The new waivers start October 1st, the 1915 I waiver and the 1115 waiver. The C waivers, which were the children's waiver, HAB waiver, and the SED waiver, are going away. The state's keeping them as programs, but they're no longer a specific state waiver. So the children's waiver was I'm not as familiar with the SED waiver. HAB waiver, we've been getting that funding forever and ever, as part of our Medicaid reimbursement. But children's waiver was remaining a fee-for-service or a direct bill to the state of Michigan. And now, as of October, that's under our capitation.
And that, you think that was the 3 million? Or
Yeah,
somewhere
I'll-
around there? But if you could get that information, it would be helpful. Thank you.
Any other questions or comments for Dave? All right, seeing none, we'll close other agenda items and move on to hearing of the public. Nick, go ahead.
Couple of quick other agenda items, sorry. First, as I sent around by email an invitation to the Chamber of Commerce meeting that Brian actually sent to me. He asked me to bring it to the attention of the board at September 30th with the Macomb legislative delegation at Ukrainian Cultural Center between 11:30 and 1:30. A couple of them came back, and Dave will forward them to you. I don't know if I had an old email address, but I did send it out to the board. Secondly, the coalition had another meeting with the governor's office and the department. I won't go into all of the details of that. If anybody wants to talk about it, let me know. But the Lakeshore change is very disturbing. It is essentially putting Beacon. The argument is that the region was mismanaged. They're going to rechange the region, not the area of the region, but the board for the region, which is different than the Community Mental Health Board because it's a multi-county, multi-CMHSP, PIHP, and I think, quite frankly, not as with less emphasis of consumer involvement. But secondly, and probably more importantly, what they've done is virtually install Beacon as the CEO, making them responsible to a board who doesn't have the authority to hire or fire. So I don't know how you have authority if you don't have authority to hire or fire. You also have a situation where Beacon will have a member on the board that's overseeing Beacon. So I've raised several of those questions on my own behalf. Others may want to hear more about it or may want to talk about it later. These aren't written in stone yet because Lakeshore has brought a administrative proceeding or administrative appeal on the decision not to renew their contract. The other lawsuits are going away. They're being settled in lieu of the decision on that administrative appeal. And so everything's been backed up by at least 3 months. The other issues we discussed with the governor's office was the need for beds, state hospital beds. CARO's been resolved at a lower level with an intent to open some additional beds in other areas of the state, but still a net loss of 5 beds, where in effect I think there's strong evidence that there's a need for additional beds around the state, not necessarily at CARO. And we raised concerns about that, as well as raising concerns about the Medicaid rate-making process. Not all of the details, because we hadn't seen all of those yet. Now I want to see them because I think there are some concerns in that for the future. But my biggest concern, I think, is that we don't see the rates before we approve the contract, and it seems to me we ought to try to expedite that process so that we can see the rates going into the contract, into signing the contract down the line, at least know what we're getting into. CARO beds, I think that covers the major issues we discussed with the administration. We are meeting with the Attorney General. The Attorney General and Senator Peters is having a function out in Novi also on September 30th. our members intend to be at that function, the coalition members, and I'll make sure everybody gets notification of that as well. It overlaps with the last thing I just suggested you may want to attend, and I know those are difficult things. Those are both during the day functions, but at least you'll have it, and if you can make it, that's good, and if you can't, obviously you can't. That's all I have.
Thanks, Nick. Kathy?
Thank you. That chamber event is, I noticed on their list of things they're going to be talking about, CMH wasn't one of them. So if it's something that's important to you, you got to get a hold of the chamber ahead of time because it's a very controlled environment for conversation, yeah.
Thank you. And one last thing, since we're talking about events during the day, on Monday, September 23rd, the Board of Commissioners invited the Macomb delegation to come, and we've done this previously just kind of for a Q&A between the commissioners and the state representatives and senators and Congress people to see kind of an update from them, what's going on, and they can hear from us. So if you want to come and sit and listen to that, or if you have questions you want asked, let me know ahead of time. But that's the 23rd here at 3 o'clock in the afternoon. All right, anybody else? Linda?
Just throw this out to whoever might have an answer. We talked before while they were on break about a supplemental that was suggested. Are there any updates on that now that they're back in session and working? Why are you laughing, Phil? Did I steal David's? Okay. Because it would have to be acted on by September 30th. And if there's something going, we want to tell them, you know.
The last update I have is that it's being tied up in the overall budget discussions. It's still being talked about as if it's going to happen, but it might not happen until October, and then we'll have to make the adjustments as we've talked about. The concern is when we look at the distribution methodology, what I heard from the staff at the department is that they're looking at using the current year methodology. If they do that, we don't get hardly anything. And the areas that are actually doing well and are in a position where they'll be returning money to the state might actually just get more money. So it seems a little backwards, but we're trying to, through the association, work with them on that as well. We'd be better off using the 2020 methodology, would benefit Macomb more.
Which is my point, a concern, I guess, that the Macomb delegation needs to be working on that somehow, but we don't really have a good connection yet or anymore this time or right now with that whole group and they weren't that cohesive when we went to them before, but that's something that through Nick's committee and through the CAC that, we need to have a vehicle of telling them what our interests are. It doesn't serve anybody to give the money in a supplemental to counties that are lapsing it and giving it back to the state. That doesn't help one citizen in the state of Michigan.
Nick, go ahead.
Yeah, just to that point, most of the information I've had it corresponds with what David said. The likelihood, I think, is that they'll roll the supplemental appropriation into the budget bills, which gives us the least amount of time to, not only time, but ability to influence it, because that's done through conference committees that are rolled into a conference committee that are not subject to amendment. So it's a very tight-knit group of people who ultimately make that decision. The state association has been aware of the very problem you mentioned, Linda, and I think understands it. Of course, they're in a difficult position because they represent the winners as well as the losers. But I think they are cognizant and have made raised the concern, and we certainly should as well. And I'll be happy to make a couple calls. Maybe we can split some calls up among area legislators, because I think the strongest argument is, why are you giving money to somebody who's lapsing money back in a budget that'll force them simply to lapse it back instead of distributing it based on need? That's the one that'll probably pull at the people making the decisions. Ultimately, at this point, budget negotiations were on hold until yesterday, almost entirely because of the logjam between the governor and the legislature as to what to do about roads. They separated that by agreement yesterday, and so now they're going forward. They've just now started what are called target negotiations, and basically targets are how much money goes to, of the total budget, how much goes to each of the departmental budgets. Obviously, we would have a big problem if every departmental budget was allowed to spend whatever they wanted without looking at the overall amount. So that's done at the leadership level, the leadership being Senator Shirkey, Speaker Chatfield, the governor, and now they've brought in the minority leadership, Jim Ananich in the Senate and Christine Grigg in the House. And they're going to split those dollars up, which will be pretty much binding on the subcommittees, and they will also address major issues. Now, what they define as major has changed from year to year depending on the people sitting in the room. That's a subjective term. This sort of a decision for a supplemental, I think, will be decided more at the leadership level than at the local level, particularly if the decision is made not to run a separate supplemental bill, but to make it part of the overall budget. We don't know the answer to that question yet, but the indications that I've been getting back from Alan and others is that it will probably be rolled into the overall budget. That could change. I don't think that's been decided. It may be a separate bill. It doesn't have to be adopted by September 30th. You can supplement a previous budget, but that's rare. It should be done by September 30th. But right now, the most important thing, the biggest objective, because of the shortness of time, is in adopting next year's budget. Because if you don't adopt that by September 30th, there's nothing appropriated on October 1. So that has become the principal priority over whether or not we have dollars to go back and redistribute from the current fiscal year. You don't do book closing, so you don't know for sure if there's a surplus or a deficit for like 90 days. So that can run into the next fiscal year. But so there's a lot of questions still up in the air. There aren't decisions made. And your suggestion, Linda, that we contact our own legislators is an excellent one.
So I don't know the process. So is this something that the county lobbyist could help us with? No? Is that what they do? I don't know what they do. Kathy knows probably better than.
Yes.
Oh, yes. They have to be made aware. Right. Okay. Thank you.
Yeah, he actually our county lobbyist was before the Board of Commissioners today and didn't have a whole lot of answers. Kind of what Dave said, everything is focused on the budget right now, and those conference committees that Nick mentioned start tomorrow. So this is because that's the plan, is to get the budget done before October 1.
Yeah, and there was some statement out of the lead. I don't remember whether it was Senator Shirkey's office or Speaker Chatfield's office, that those may be delayed till next week, only because the conference committees, which were scheduled to go tomorrow, can't finalize their conferences until the targets are finalized, and those targets are still in discussion. So this week and next week will tell the tale, I think.
Yep, so that's where we're at. But the county lobbyist is aware, and we can make him more aware. Just throwing that out there. Anybody else? His name is Gary Owen. He works at GCSI. I'll get you his phone number later. Anybody else with other items? All right, seeing none. Now we'll move on to hearing of the public. Anybody from the public wishing to speak? Anybody from the public? All right, we will close the hearing of the public. I'll take a motion to adjourn. Motion from Lori, support from Megan. All in favor? Aye. We are adjourned.